Professor Tomita has really done a wonderful job advancing our understanding of refractive surgery. Again, I think that partially goes hand in hand with being in Japan, where there is so much advanced technology and has been for so long. We're really learning a lot in the United States, where our process is a bit slower, unfortunately, to get new technology. I've known Professor Tomita for a few years now, working with him through the ISRS, and it's really been a pleasure to get to know him and work with him internationally because of how much work he's doing here in Japan and what a good job he's doing at educating the rest of us.
Zima have a new laser that's available now for femtocataract surgery. So Tomita has been one of the sort of pioneers in pushing the availability from this. I think he and we both think alike in the fact that if we're going to introduce new technology, we want something that's easy for surgeons to use.
Dr. Tomita is a leader in refractive surgery worldwide. His international recognition has come from the contributions that he's made to the field in all areas, in particular with surgical correction of presbyopia, for corneal collagen cross-linking, and for working with new technologies. He's lectured and published internationally, published in multiple peer-reviewed journals with multiple papers, and he continues to contribute to the field in a very meaningful way.
I think Dr. Tomita has done a great job. To be honest, he's one of the most important researchers right now. I had the chance to review a couple of his papers for JCRS or JRS, and he's doing a great job. And especially when we talk about presbyopic options, those are actually a very, very important field to be working right now, because we have a huge amount of patients coming every day to our clinical practice and asking about new options for them to get rid of their glasses and being totally free of glasses. So it's been great. All the work Dr. Tomita has done, it's been really, really good.
Dr. Tomita is to be congratulated on getting a very interesting group of people from all over the world. And I think to a great extent that reflects the respect that we have for him as a leader in the field. His work is exceptional, and the numbers of patients that go through the clinic in a safe and very efficient way actually provide a database that is not available anywhere else in the world. So his work is unique in providing huge numbers with very good statistical value, and he has demonstrated the safety and efficacy of many of these new technologies.
Dr. Tomita has the advantage of being head of a very well-known, very large, and exceptionally well-respected practice for a number of different technologies. Now, the interesting thing too is that I am, if you might say, personally acquainted with his success, having been a patient of Dr. Tomita. I traveled here from the United States to have both LASIK and the presbya corneal inlay almost 3 years ago, and so I'm directly benefiting from his expertise.
Dr. Tomita is one of the most experienced refractive surgeons in the world, probably number one in terms of volume. So when he speaks with authority, and his experience, as well as those of his colleagues, I think really enriches this, and it's great to have this session occurring before the World Ophthalmology Congress itself. Of course, Dr. Tomita is the #1 implanter of the camera AccuFocus inlay, and we all listen very carefully to his results and his techniques in order to learn how to do those technologies successfully.
Minoru Tomita was with me in Chennai in India last year in July. And the Indian Intraocular Implant and Refractive Society in India honored him with a very special IIRSI gold medal, which is the highest award given by the society to an outsider. And I think that itself sums up that Minoru is top class.
Well, Dr. Tomita has been very efficient in creating evidence in favor of different technologies. The high volumes that he has handled indeed have fostered the development and the implantation of many innovations that at this moment are much more clear than than before the studies were performed. And indeed, I again feel a lot of respect, because that means a lot of work, a lot of time devoted to the patients, and a lot of thinking about what is the best option for them.
Professor Tomita is doing good work and investigations with the presbyopia technology, using some corneal inlays for the presbyopia with wonderful results. There are many publications in the
I think Professor Tomita is right up there in the list of thought leaders who are developing the technologies to treat patients with these diseases for the future.
Dr. Tomita has, I think, been a very strong and powerful innovator, and he has he's juggling many balls in the air all at once, but he's doing it with excellence and with really, I think, in a way that he's making major contributions to all of these areas. So I'm sure Japan is very proud of his international contributions.
I know his work concerning LASIK and concerning cataract surgery as well as presbyopia surgery. And during private talks with him, private discussions, I felt that he is a very good specialist, not only from the ophthalmology side, he has also a deep understanding in the physics and the optics of the eye. So he's a very very good discussion partner, even for a physicist like me.
I think one of the unique things for Dr. Tomita is that he has access to many different technologies, and he has a very high volume with his surgical practice, and that really allows him to refine and sort of titrate what is the best technology for a certain condition. So his practice has refined the technologies and the techniques for surgery to make things better as the practice grows.